Hello everyone, I'm your host Aditi Lamba. Welcome to another edition of ITV Gold Presents Coronavirus Pandemic Report. Joining us today via Skype, we have the privilege and honor of having with us Dr. Lieutenant Colonel Kamal Singh Kalsi. He's joining us via New Jersey, and he is not only just a prominent voice in Sikh American military, but he's also a very prominent voice in medicine, and his expertise in medical services as well as emergency medicine, disaster and operational medicine is truly going to bring forth more perspective and perhaps more information and updates on COVID-19. So let's welcome via Skype, joining us from New Jersey, we have with us Dr. Lieutenant Colonel Kamal Singh Kalsi. Thank you so much for joining us.
Hi, Aditi. Pleasure to be here. And again, as always, I'm just talking here on my own behalf, not on behalf.
Medicine you have served in the US and outside. According to you as a medical professional, even though you're in quarantine right now, your take on the second week of quarantine, the importance of it from a medical point of view, and also your take on social distancing right now.
Yeah, what we have in place right now is not truly a quarantine. It's just a stay-at-home order.
Right.
And we're all pushing for social distancing. And so that, studies have shown that the virus itself can transmit across anywhere from 6 to 15 feet. So that's why it's important that we not go out and meet our friends and keep away from areas unless absolutely necessary, because it is very, very easy to transmit this virus. It is several times more communicable or infective than the regular flu. And a lot of the individuals that are infected, and this is based on European and Chinese data, a lot of the individuals that are infected may not show symptoms, especially if they're young. And so it's these young folks that are potentially infected but not showing any symptoms that may be actually transmitting this virus all over the place. So even though somebody looks okay, it doesn't necessarily mean that they're not infected.
Right, and I think you bring up such an important point in this, Dr. Lieutenant Colonel Kamal Kalsi, the impact of younger, generations here. This is something that we keep on hearing a lot this week, that if you are young, that necessarily doesn't mean you are, away from the threat of the virus, and also you could actually potentially be a threat to, older Americans living here. Your comment to the young generations watching you on ITV Gold right now, and the importance of social distancing for them.
Yeah, it's critical that they practice social distancing, not just for our elder population, but really for themselves. We have been seeing a lot of folks that are in their 30s and 40s, and then we're also seeing kids. Right. And that mirrors some of the data coming out of Europe, where maybe around 2 or 3% of the population that's being hospitalized are actually younger people. So this disease definitely affects everybody, but it is definitely more deadly to the older generation.
Right, and right when you're saying this, I would like to discuss the current numbers, which we are seeing over 74,000 cases in the US right now as we're having this interview. This interview is going to air tonight itself, and over 1,000 deaths already in the US. These numbers are definitely really alarming, and a lot of the community members here just do not know where at risk they are, when they should go to the ER, when they should go to their primary care doctor. So as I've been asking all medical professionals here on ITV Gold, your take on that, and how should the audience and the community be sort of evaluating their own symptoms to ensure that they do not accidentally get infected or catch the virus if they're visiting these places?
Yeah, no, those are all very, very important questions. With regards to when you should be going to the ER, if you're feeling very, very short of breath, you have a very high fever, you have chest pain, you have any sort of severe pain, you should go to the ER, to the emergency room. Otherwise, our goal right now should be to keep the ERs free and clear and open. Otherwise, what's going to happen is we will get a rush of people, and we're already seeing this in parts of New York. You get a rush of people that go to the ER, and then your regular emergencies can't be taken care of. Your heart attacks, your strokes, bad asthma attacks, your diabetics and other metabolic emergencies, and traumas as well. All those regular emergencies are still going on, and on top of that, we have to now take care of coronavirus infections. So do not go to the ER unless you absolutely, absolutely need to be there. And like I said, if you're feeling horrible, maybe the best bet is to try to call your primary care doctor first, your regular family doctor, and let them have a conversation with you.
Yes, and I think that's a very important advice that you just gave, and I really truly appreciate you. I kind of want to discuss a little bit about what is happening in the ERs across the country right now, and also what is happening in terms of the medical care providers, healthcare workers. We are seeing so much on the need of PPE, the protective personal equipment, and also the need for ventilators, hospital beds. We just had the governor of New Jersey 2 days ago tell us that he's in conversation with the federal government to have more pop-up hospitals and more supplies for everyone. Your take on what disparities you've seen so far, and I'm sure you must be in touch with a lot of doctors and a lot of providers. If you can give us an insight into what's happening so the audience understand the importance of these PPEs, I would really appreciate that.
Yeah, and when we talk broadly about PPE, it's hard to sort of, for a layperson to understand what we're talking about. But when you see those pictures of people in the full white suits, head to toe covered with the face mask, ventilator,
Right.
that is the respirators. That's the full protective gear, and that's what they've been doing in Europe and in China,
Right.
and here in the U.S. we have N95 masks, and
Right.
sometimes we don't even have that. We have just regular surgical masks, and healthcare workers are running out of these things very, very quickly. I mean, to the point where many of us are just using one mask for the entire day.
Yeah.
Some folks don't even have that, and the CDC has recommended that we, if we don't have anything, that we use bandanas, which
Wow.
I find a little insulting. I'm a doctor. I'm not a pirate or a cowboy.
Yeah.
They want us to wear bandanas. I think at the very least, our systems, our hospitals, our country should provide for basic protections.
Right. And, just a little bit more on the PPE, right? Just like you suggested and you said, a lot of doctors, we even just see on social media, literally sharing the picture of their mask that they have worn 5th day in a row because there's such a huge lag, especially in the tri-state area. Could you please explain to everyone the need of fresh masks and how these equipments are technically not supposed to be reused? I'm sure you would agree with that, especially because you work in the ER.
Yeah. What we're going through right now is sort of unprecedented. We typically change our masks, with every patient encounter. So you go into the room, you have a mask on, and then you come out and you discard the mask so that there's no risk of transmission to the next patient. Here now, in today's day, we have to keep using the same mask just because we don't have any. Our supply is so limited.
Yes.
So we're definitely worried about our own health and safety. We're worried about the patient's health and safety. There's a tremendous amount of stress amongst our fellow healthcare workers. I know I've seen nurses crying.
Yeah.
I've seen doctors crying. They are. I know of a colleague that actually quit. He quit his job because
Wow.
it was just a tremendous amount of stress. So we're just at the beginning of this. some hospitals in New York and in some of the hardest hit areas are actually almost nearing their ICU capacity.
Yeah.
By the end of the week, I think most ICUs in the hardest hit areas will be full, if not beyond capacity. And what you're going to see is in the coming days is there's going to be a domino effect where as the ICUs here start to fill up,
Right.
we'll start to push out west into other ICUs, push these patients into other ICUs and do transfers. And eventually, all the ICUs in the nation will be full. And we're going to run out of vents. That's going to happen very, very quickly. So there are a few different efforts that we're trying to engage in to help close that gap. And what we really need is our president to enact the Defense Production Act so
Right.
that they can compel companies to spin up and produce these ventilators and other equipment that and PPE that's needed for this fight.
So if I was to ask you right now, after all the information you just gave us, how do you see the next few weeks sort of lay out in terms of, the obstacles you may face, as the doctors may face right now, also the issues with the government, with fundings. Where is the greatest need of the hour according to you right now?
The are going to be really hard. The biggest challenges are going to be in deploying ventilators and PPE, and actually just taking care of some of these exceptionally sick patients that are coming in. Hospital ERs are already setting up triage tents outside the hospitals. I know some temporary morgues have also been set up in New York just because the regular morgues have already been filled. And this is definitely an emergency situation. And at the end of this,
Right.
when we look back on this, it's going to have had a profound effect on our country and our communities.
Yes, for sure. In terms of discussing just more on coronavirus and more related updates, are there any significant updates in treatment and vaccine? We keep on hearing about certain drugs that are being experimented on or researched on currently. The White House has also, through the president, suggested these drugs. We know that the research is still pending. Any comments on that or any information that you would like to share with our audience?
No, I would really welcome and love to hear that there is some cure available, but that's just not the case right now. And I think there's some promise in a number of different drugs, but the studies that have come out thus far really have not shown any clear benefit. The chloroquine study that was done in France. It was a particularly flawed study. They eliminated, it was a very, very small study to begin with. I think it was less than 40 patients, but they eliminated 6 of those patients because they either went to the ICU or they died. So,
Wow.
when they say, oh yeah, all these patients were on hydrochloroquine and they did really, really well. Well, yeah, of course. You eliminated the patients that went to the ICU and the ones that died.
Right.
That's it doesn't make any sense to me.
Yeah.
You could just as easily also say all of those patients with coronavirus were wearing underwear. That doesn't
Yeah.
mean that everybody wearing underwear is infected with coronavirus. So,
True.
it's just bad research. And, I think we need to understand and commit to doing good science. And if we do that, we can get through this. But we can't do this without a regimented approach. And we have to have a scientific approach to all this.
Well, I asked you because my follow-up question is actually about the concern of community here, especially the South Asian American community. Suddenly, this week we're all worried about our parents, we're all worried about our grandparents, we're worried about anybody that's older than the age of 50, which has significantly changed. Last week we were still worrying about older, elderly, senior citizens here. But the question here is, a lot of the patients that are sending us questions are concerned about the chronic conditions that are really prevalent with South Asian Americans, such as heart diseases, diabetes, hypertension, cholesterol. Do you see that becoming an issue with elderly patients, or perhaps patients that have that and are above the age of 50? Your comments on that as a doctor?
Yeah, it's all these comorbidities, as we call them in medicine, whether it's diabetes or high blood pressure or underlying lung issues, they do seem to affect the immune system in one way or another. So my parents, for example, are on lockdown at home, and they just know that for the next several months until this whole thing blows over, they're going to be at home. And so my wife and I, we do the shopping,
Right.
we go get the grocery, we do whatever we need to get, we take care of. And then, they enjoy the house and they exercise at home. They walk around outside on the lawn, but that's about it, because this patient population is at a very, very high risk for developing complications like pneumonia and respiratory failure,
Right.
which requires ventilator support.
Right. So obviously we all have to take precautions. In terms of discussing a little bit more on COVID-19, and after this I would just briefly like to reflect upon, the role of military right now that's being played in helping disaster management. Mental health awareness has come up as a key topic, and we have discussed it with other medical professionals here on ITV Gold as well. How do you sort of keep the chaos in the community to a certain calm level right now? Your advice to individuals that are suffering the economic loss, are having the stress and the anxiety of this pandemic. It's really put the entire country on a lockdown. Your comments on how we really raise mental health awareness and also provide resources for the ones that are suffering.
Yeah, it's a wonderful point you make, and it's a good question. I know that New York City and New York State have deployed mental health hotlines that you can call and get help with. I think New Jersey has a similar effort. This is a very, very stressful time, and I think we can all step back and try to figure out how we can still maintain our ties to the community, to each other, and help each other while we get through this fight. I think it's important to check on our family and our elders. So even just it's something as simple as a daily phone call or a video call, I think makes people feel better. It certainly makes me feel better when I can talk to my family and friends, and maybe getting out and enjoying some fresh air in your backyard if you have that available to you.
Yeah.
If not, then maybe just doing some exercise at home. I think yoga is a wonderful way to exercise, and that will also help you combat stress and stay in good spirits.
Another question just in regards to this, as a South Asian parent, and I'm sure your kid is home as well, and along with many millions of children in America that are all basically under lockdown, a quick tip or maybe a comment for South Asian parents watching you, perhaps they could get some advice into how to cater to that, and also just your take on managing everything being a South Asian parent.
I think it's important to have a routine for the kids. Before they would wake up and go to school, and then after school they would have a bunch of different activities. We are trying to maintain a routine for them So they get up in the morning, they brush, they get dressed, and then they go downstairs, and they have little desk areas that they've set up for themselves, and
Nice.
that's where they do their school. And they sit there, and they their school actually has done an amazing job of putting together an online curriculum. So
Wow.
they go through videos and online workflow, and each day they have some homework. So they're very, very dedicated. And then after they're done with their schoolwork, we make sure that they read, they go out and play,
Right.
in our yard. We make sure that they get exercise every day.
Yes.
They've started doing their karate again, but it's done virtually. So their instructor actually has set up like I think a video classroom,
Wow.
and so they all do their practice their taekwondo that way. I know my daughter has started some art and other classes also virtually
Oh, wow.
through video conferencing. And I think we just have to look for innovative ways to do the things that we're otherwise used to doing. And it's going to take it's going to feel a little weird at first, but I think you'll find that it's really not all that different. Learning can happen anywhere, and I think
Yeah.
it's now more important than ever that we continue that process of learning.
Yes, that is so great. And what a great shout out to e-learning for all of the parents that are concerned about the education of their children. I truly appreciate you sharing that. I would like to take this moment to quickly reflect upon just a little segment on the Army, just because we have you here. I have to ask you certain questions related to it. I have a quote here which basically said that the U.S. military is now preparing and plans to take over hotels, other buildings, if necessary, to add to the nation's supply of hospital rooms, parts of a response to coronavirus emergency. And, since then, we have seen the National Guard being deployed in parts of the country. They're also here in New York, in New Rochelle area. The National Guard is doing a lot of work currently in order to sort of, act on these emergency services. Your comment on the role that the military will play in this pandemic, and it's already playing, and especially the comments on the National Guard, they're going to be playing such a huge role and also risk their lives. So what do you have to say about that?
Yeah, that's me expressing my own opinions. I don't speak on behalf of the Army or the National Guard or DoD, but the military is going to play an important role in stabilizing the effort and providing logistics. So I know in New York they've helped set up triage areas. I know in other areas they've actually opened up hospitals and built field hospitals like we would in Afghanistan or Iraq or other parts of the world. So we're building facilities. We're helping to provide logistics as well as support and security. And I know security is always a big issue during these times of disaster. So the military is a very, very capable and qualified team of individuals, and I know if we can mobilize them against this pandemic, I know we'll be much better off.
Definitely. And just in terms of talking about that just a little bit more, you have expertise again in EMS, in operational and disaster medicine. You served in Afghanistan in those kind of conditions. My question to you is military prepared to handle a pandemic like the coronavirus? They will also be risking their life again to help everyone in terms of whatever needs are there. But your take on how prepared is the military for disaster management?
The military has plans to take care of a variety of problems and issues, and we already have practiced many of these things in going to war. So building out hospitals, building out triage areas. This is something we're used to doing anyway. So you're never really prepared for something of this magnitude. It's a very, very large task.
Yeah.
But I know the military will rise to the occasion. A number of my friends have been called up
Oh,
and
wow.
are a part of this effort. So I am sure the military will do everything in its power to protect the people of our nation.
What's your message to your fellow soldiers, all the fellow doctors even that that are going to be going on the field right now?
I would, I just say, make sure you have adequate PPE. Make sure that you be very, very careful, very vigilant. Make sure you take care of patients in open air settings. Um, I fight. It's not going to be over in just a few weeks. It's, I think, potentially going to go on for months.
Yeah.
But make sure you all take care of yourselves and each other.
I would also love to take this moment and have you give a message out to the friends and families of medical professionals, doctors, healthcare workers who are truly in the front line that we hear about every single day. A message out for their friends and family.
Yeah, the families of our fellow healthcare workers are really also on the front lines as well.
Yeah.
When I come back from having taken care of all these patients all day, first thing I do is, I run upstairs, take my clothes off, and hit the shower. It's tough and it's scary for the family because they don't know. If I may get infected or if I get sick, what happens? So it's tough, and I think a number of us are in yeah, about those types of things. But this is what we signed up for,
Yeah.
and we will do the best we can to our abilities. But I think moving forward, once we have had get a handle on this, I think it's important that we address, how we got here, and we take better steps to make sure this never happens again. And I think we need better protections for our healthcare workers. I think this is quite frankly unacceptable that we are without PPE and ventilators.
Yes, and I think there's an entire country that's supporting that the healthcare workers do need their PPE, and they definitely need a lot of protection. I truly appreciate your service and your time. I know it's not easy to serve during this time period, especially being a doctor. SEVA is such a huge part of you is a huge part of the Sikh American voice in the U.S. military. I would like to know if the Sikh American Veterans Alliance is currently doing any work towards the pandemic, and also any resources or support available for the military veterans through your nonprofit.
Yeah, we've been in touch with a number of military medical units that need PPE. So we are currently trying to help them, help donate PPE to these military medical units. So if anybody has a desire to help us do that, please reach out to us. Our website is www.seva.org, so SAVA.org.
Yes. Well, thank you so much for your time. And again, thank you so much. As a medical professional, I really, truly appreciate you giving us your time and giving us insight, and also helping all these patients that you are on an everyday basis. One last message for everyone watching you on ITV Gold.
I want everybody to just know that we are going to get through this. Things will be okay. It's not going to be an easy fight, but I also want you to prepare for the future. Don't ever let this situation happen again, and let's make sure we hold our public officials accountable for all this. I think this is going to be a tough fight, but we're going to get through it. And then it's our job as citizens to make sure that this scenario never happens again.
Yes. Thank you so much for your time. Thank you so much for joining us.
Thank you.
All right, and that was none other than Dr. Lieutenant Colonel Kamal Kalsi joining us via New Jersey from Skype. Thank you so much for joining us. I'm Aditi Lamba signing off.